Hello, everyone. As Chair of the Committee on Guidance on PFAS Testing and Health Outcomes, I would like to welcome everyone to the first day of the committee's 5th meeting. I want to note that this is an open, on-the-record information gathering session. That is, the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions, and it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the academies. For those of you not familiar with the committee process, this is the 5th of several planned committee meetings. In the public sessions, we'll have the opportunity to hear from many experts in the field and receive public testimony. The committee will deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee. And the committee must then respond to this review with appropriate revisions that adequately satisfy the Academies Report Review Committee and the chair of the National Research Council before it is considered an NRC report. The expected report release is spring of 2022. Further information on the study, including future meetings, can be found at the project website. The easiest way for me to get there is to go to NASEM through my search engine and then search on PFAS. And we'll also put that link in the chat. Thank you. The committee is being asked to provide advice for clinicians about PFAS testing and how test results should inform clinical care. Additionally, our expert committee will examine the health outcomes associated with PFAS exposure and will develop principles clinicians can use to advise patients on exposure reduction. In this meeting, the committee will hear from experts on the contribution of PFAS exposure sources to human exposure, clinical principles for advising patients on exposure reduction, putative effects of PFAS, health effects of PFAS, and methods for evidence synthesis. During panel discussions, the moderator and committee will ask questions of the speakers. If you're viewing on the web, you may send any comments to Liz Boyle at eboyle, that's E-B-O-Y-L-E, at nas.edu. I'll tell you this meeting is being recorded and that available speaker presentations will be posted to the project website soon after the meeting. At this point, I'd like to ask the committee members to briefly introduce themselves with their name and affiliation, just in the interest of time. I am Ned Kalange. I'm the president and CEO of the Colorado Trust and a faculty member at the University of Colorado School of Medicine and School of Public Health. And Laura, could you please introduce yourself?
Welcome, Laura Anderco, College of Nursing, Villanova University. I'm co-director of the Mid-Atlantic Center for Children's Health and the Environment.
And is Dana joined us? Not as yet. Kevin?
I'm Kevin Elliott. I'm a faculty member at Michigan State University and a member of MSU's Center for PFAS Research.
Thanks, Kevin. Melissa?
Hi, I'm Melissa Gonzalez. I'm a professor in the School of Medicine, the Division of Epi, Biostats, and Preventive Medicine at the University of New Mexico, and I'm also a member of our Superfund Research Center.
Thanks. Erin Haynes?
Hi, I'm Erin Haynes. I am a professor and chair of the Department of Epidemiology and Preventive Medicine and Environmental Health at the University of Kentucky. I'm also deputy director of our Environmental Health Center and a member of our Superfund Center.
Thanks. Jane?
Hi, I'm Jane Hoppin. I'm a professor at North Carolina State University. I'm involved in our Superfund Center at NC State, and I'm the deputy director of our NIHS Core Center.
Thank you. Tamara?
Hi, everyone. I'm Tamara James Todd. I'm an associate professor of environmental reproductive epidemiology at Harvard Chan School of Public Health, where I'm the director of the Organics Core for our P30 Center, as well as the director of our Community Engagement Core for our Superfund Research Center.
Thanks, Tamara. Alex?
I'm Alex Kemper. I'm the Chief of the Division of Primary Care Pediatrics at Nationwide Children's Hospital in Columbus, Ohio.
And Brian?
Good afternoon. My name is Brian Lind, and I'm an occupational and environmental medicine physician at the Yale School of Medicine.
Mark?
Hi, my name is Mark Werner, and I'm an associate professor at the University of Montreal School of Public Health.
And Veronica?
Hi, I'm Veronica Vieira, and I'm professor and chair of the Department of Environmental and Occupational Health at the University of California in Irvine.
Thanks, Veronica. Shiban?
Hello, I'm Xiaobing Wang. I'm a professor at the Johns Hopkins Bloomberg School of Public Health and School of Medicine, and I direct the Center on Early Life Origins of Disease.
Thanks. Chris?
Good morning. I'm Chris Wyatt. I'm the retired founding CEO and president of the Caring for Colorado Foundation, a health funder in Colorado.
And now I'd like to turn to the National Academy staff to briefly introduce themselves, starting with Elizabeth.
Hi, I'm Elizabeth Boyle. I'm a senior program officer at the National Academies in the Health and Medicine Division, and I'm the director of this study.
And Rose, have you joined us? Let me move on to Cliff.
Hello, I'm Cliff Duke. I'm director of the Academy's Board on Environmental Studies and Toxicology.
Thanks. Marilee?
Hi, I'm Marilee Shelton Davenport with the Board on Environmental Studies and Toxicology.
And Kate?
Hello, everyone. I'm Kate Guyton. I'm a senior program officer on the Board of Environmental Studies and Toxicology.
Kaylee?
Hi, everyone. I'm Kaylee Bynes. I'm an associate program officer on the Board of Environmental Studies and Toxicology.
And Alexandra?
Hello, everyone. I'm Alexandra McKay, and I'm senior program assistant, and I'm on the Board of Population Health and Public Health Practice.
Thanks so much, especially for your brevity. Just to let folks know that today's sessions are going to cover the current knowledge about the contribution of PFAS exposure sources, including drinking water, diet, the indoor environment, and other exposures in terms of human exposure, and help develop principles clinicians can use to advise patients on exposure reduction, which is part of our statement of tasks. The way we've put the meeting together is we'll have individual talks by invited speakers, followed by panel discussions grouped by topic area. Committee members can then ask questions using the raise hand function during the panel discussion, and we'll close the afternoon with public comments.